Why is hip mobility so important? We need to target hip mobility because if you don't, the knees and the low back suffer the most. What's going on, guys? Dr. Greg here. Today we're going to talk a little bit about hip mobility. It's one of the things that as we get older, we don't work it enough, we don't use it, we lose it. If our hips aren't moving well when we squat, when we golf, when we run, then the knee and the low back are two joints that are adjacent to the hip, and they're going to have to compensate and move way more. And that's when they're going to start to break down and injuries start to occur. So hip mobility wise, what I always tell my patients is we can't just stretch ad nauseum. We have to work on joint mobility first before we try to stretch the muscles around the joint. It's not just about tight muscles, it's about a tight joint. So we like to utilize this power band, as you see here, where we can really work on gaining what we call arthrokinematic motion of the joint. We're getting a slide, a roll, and a glide, and all these nice little motions within the joint so that when you do our bigger functional movements, whether you're at CrossFit or on the golf course, the hip is moving the way it's intended to. If you're having trouble with hip mobility, come see us. Movement is medicine.